Hello and welcome to everyone. Thank you so much for tuning in to today's discussion. This is part of SAIA's patient education live stream discussions that have been ongoing for the last several months. We are very excited to have this very important discussion today around mental health and IBD. And this is something that is very taboo, that's kept very hush-hush, and that is true for all IBD patients, and it takes a particular form and it has a particular valence, especially in the South Asian community. And because of all of this silence and the taboo and stigma around mental health, patients and caregivers carry that enormous burden of navigating IBD and the impact that it has on our mental well-being silently, and we often are hesitant to seek help for the fear of log kya kahenge, what will people say? And this is something that we really want to address. We want to break the silence around this today. And to that end, we have an amazing panel of experts to shatter the stigma and talk openly about mental health and how to navigate your mental health with IBD. So let's start off with a round of introductions. I'm just going to ask the providers and the patient experts that we have here today to introduce themselves quickly before we dive into the discussion. I'm Madhura. I'm a Crohn's disease patient and I live in India, and I'm part of the South Asian IBD Alliance. Dr. Pandit, would you like to go next?
Sure. I'm Dr. Anjali Pandit. I am a GI psychologist at Northwestern in Chicago, and very grateful to be part of this discussion today and have been connected to SAIA for the last several years.
Awesome. Ashley, would you like to go next?
Sure. Good morning, everyone, or good evening. My name is Ashley Patel. I'm located in Toronto, Ontario, Canada. I live with Crohn's disease and I was diagnosed in 2021. And I'm also extremely grateful to be a part of this very important conversation.
Thank you. Dr. Taft?
Hi, I'm Dr. Tiffany Taft, also a clinical psychologist in Chicago. Currently affiliated with the Rome Foundation Research Institute, formerly a colleague of Anjali's at Northwestern. And I'm also a Crohn's disease patient. I've had Crohn's since around 2001, so a long time. Been connected to SAIA for several years now and just really excited to be here.
Thank you so much. And last but not least, Dr. Sumit, would you like to introduce yourself?
Hi, good evening, good morning, wherever you are. Thank you for joining in. My name is Dr. Sumit Bhatia. I'm a gastroenterologist. I practice at Paras Health in Gurgaon, India. And I have special interest in treating IBD patients. And I have been with SAIA ever since SAIA was incepted. I'm proud to be a part of this association. And I'm very, very excited for being on today's chat. Thank you for inviting me. Thank you.
Awesome. Thank you, everyone. And we're so happy to have all of you here bringing in the multidisciplinary expertise, the patient expertise, the IBD specialist expertise. And we really hope that this will help build a robust conversation around mental health, but also really address some of the very typical patient questions that we get. And to that end, I kind of want to start by asking the mental health and IBD 101 question, right? Which is, how does mental health affect IBD and how does IBD affect mental health? And what should we as patients know about this relationship between mental health and IBD? Dr. Pandit, if you'd like to go first, and Dr. Taft, please feel free to add as well.
Absolutely. Again, such an important topic. For one thing, we know that the gut and brain are connected to each other. So that is fact. We know that. And our behaviors and our health are connected to each other as well. And in studying patients with IBD, we see that there are incredibly high rates of depression, anxiety, and we'll speak to trauma as well in this conversation, with those rates being between 25 up to 30%, possibly more because of, to your point, Mother, about disclosure. I think there's taboo about how much to talk about mental health, and that might actually influence how much we know about the prevalence of these conditions. But we also know that there's a bidirectional relationship. We know that mental health affects disease activity, and disease activity affects mental health. And so it really can become an incredibly vicious cycle that are very interconnected. There are some really, really recent consensus guidelines that were actually just put out, maybe even this month, about the importance of screening and treating depression and anxiety in patients with IBD. because it's on par to what clinicians should be thinking about when it comes to clinical remission, endoscopic activity. That's all depression and anxiety plays such a relevant role in how much a patient can do the self-management that is so critical for IBD outcomes, that we're asking now, folks like Dr. Bhatia here to, in their GI visits with patients, talk about depression and anxiety and trauma, because of that relevance and importance and how much it affects patients long-term.
I think that's very helpful to understand. And Dr. Taft, if I could ask you to kind of elaborate a little bit more on what Dr. Pandit said about the bidirectional relationship between IBD and mental health. Does IBD drive worsening mental health outcomes? And does mental health cause your IBD to get worse? What is it? What does that relationship look like?
Yeah, and as Dr. Pandit said, it's really complicated. And I think it's the stigma associated with this in part is, are my symptoms real? Is the doctor saying this is all in my head, or that I just need to manage my stress better and my colon will somehow magically look better? So when we talk about this, I always emphasize this is not negating physical processes that we typically think about with IBD. However, we do know that the nervous system, the central nervous system, the brain in particular, but all the nerves that go down and wrap around our digestive system impact it significantly. The easiest example is butterflies in your stomach, right? You're nervous. What do you feel? Some people might feel a little bit of nausea. They might even need to go to the bathroom. That's everybody. That's our wiring. But now more recently, what we see in IBD and other gut conditions is the role of the microbiome. So all the bacteria and fungi and all the stuff that's down in there that's implicated in IBD being off balance, not being like a healthy person with a healthy colon. The nervous system talks to those little bacteria and those things down there in the microbiome, and they send signals back up to the brain. They're implicating conditions like Parkinson's disease in the gut microbiome, not necessarily just the brain. So there's this complex pathophysiological processes going on that, there's people with IBD that are like, I never had problems with anxiety, and now I do, but I'm not really an anxious person, but I can't shake this anxiety that I have. And some studies are starting to suggest it might be the microbiome signaling the brain and causing anxiety or depression symptoms in people who are generally not had, a lot of trouble with that. So we tend to think because IBD is so difficult to live with, that's why people are anxious and depressed. And that's can actually absolutely be true. But also our gut bacteria and flora can be affecting our mental health. And then if I'm stressed, that goes down to my gut and triggers those symptoms as well. So it's such a complicated condition, and process that, we're just starting to really understand it.
Absolutely. And I think that is so important to pay attention to for us as patients as well. I think there is to kind of bring together what both of you have said, there's a very complex relationship between the brain and the gut. The gut-brain axis is very important to pay attention to. IBD can make you feel depressed and anxious because of how challenging it is to live with. At the same time, we have a lot left to understand because of this feeling that we cannot talk openly about our mental health. And also this idea of the gut microbiome influencing the ways in which we deal with our mental health is very important to pay attention to as well. The bottom line really is that this is not all in your head. Just because it is about your mental health does not mean this is not real. These are real and valid symptoms, and it's very important for us as patients not to be dismissive of them and to seek the care when we feel that we really need the help. And with that, I want to turn to Dr. Bhatia as well, because of something Dr. Pandit said, which I think is very important, which is what should the IBD specialist do, right? This idea that the clinical guidelines that say IBD specialists must now start having conversations with their patients about anxiety and depression, must start screening. In a country like India, and I know this from my experience as well, often you are the first point of contact as a GI, and this is true for other people as well. So what do you do to help your patients navigate mental health concerns? When do you refer to mental health services? And finally, keeping in mind that, we've already started discussing the elephant in the room, which is stigma, how do you help your patients accept mental health, seeking mental health help?
Okay, first of all, thank you for asking that. And I'm not sure I'm able to help all my patients. I'll be very, very honest here. And elephant in the room is the stigma. So when we tell a patient, in the first visit of the patient, we tell them about a diagnosis of IBD, the first problem in India, what we face, and generally which I perceive, is the acceptance. So any kind of chronic illness in our country is like perceived as having a big stigma. The problem starts there. And on top of it, none of my patients will be forthcoming in telling us like whether they are actually going through depression, anxiety. It's actually boils down to the physician who's talking to them to perceive if they feel that, the patient is actually depressed or anxious or not sleeping well, not eating well. So there are subtle questions which I generally ask when I'm, talking to them apart from their GI symptoms. So it's not at all enough for a GI specialist to just ask how many bloody stools they are passing, whether they are having abdominal pain, whether they are taking their meds, and write a prescription and send them off. I think that will be, a disservice to treating IBD. We have to talk to them that how they are feeling. It takes another 5 minutes of our time, but I have seen that it makes a difference with our patients. So once you ask them how they are feeling, not how many stools they are passing or what kind of medications they are taking, there are a lot of things. Most of these patients are young. Some of these are, in the 6th and 7th decade, so they are elderly. So there are different challenges they're facing in their lives. So, to ask them how they're feeling, I think is the first and foremost, which many of us as physicians don't do. It may be the pressures of having a very busy OPD. It may be the pressures of, not being empathetic enough. But I think that's the first goal. Then I think I have my own questionnaire to assess whether they have any significant depressive symptoms or not. And then if I feel that, I'm not able to help them enough, I generally, in a very, very subtle way, try to suggest that they should be seeking professional help, which anyways, again, as you are aware, is stigmatized in this country. So talk to the patient, listen to the patient, specifically asking about how you are feeling, I think makes a difference.
I cannot agree more. And as a patient, for me to feel like I'm not a collection of symptoms, but that I'm a whole person, and my provider viewing that, treating me as a whole person really helps to start beginning some of these conversations about what is going on with me beyond what my symptoms are. And Dr. Taft and Dr. Pandit, what are some of the common mental health challenges that you see in patients with IBD? And how do you start having some of these conversations when patients reach you as mental health providers, as GI psychologists? And finally, why is it so important? Why should we be concerned about mental health with IBD?
I'm happy to start.
Yes.
I think so part of your question is just how do I start those conversations? I think, I'm lucky enough to work in an institution in which my patients are referred by their GI providers who have sort of started the conversation with the patient. So in that way, certainly I'm introducing this concept of mental health in a very in-depth, nosy interview that I'm doing with the patient the first time I meet them. But, to Dr. Bhatia's point, having that initial conversation within the medical visit can really help. It's challenging though. I think patients might feel a little uncertain and hesitant to talk about those, whether it's mental health factors or depression and anxiety with their medical provider, worrying about, if I only have so many minutes, I want to make sure I give them the important details about what's going on with me. And so, I so appreciate this idea of let's really talk about depression, anxiety, mental health with all of our IBD patients and talk with them about these guidelines to do this comprehensive screening across every IBD patient that comes into the door so that we can have these pathways created. But I think, a lot of times my patients who are from South Asian descent and even otherwise, when we talk about even just getting to the diagnosis of IBD, there's a lot of self-reflection and what did I do? So exploring some of that with patients and providing psychoeducation about what IBD is and clarifying that misconception of, this is my fault. I did something wrong, which I think is just augmented in the South Asian communities, at least in the patients that I've worked with. There's a pressure to be a certain way and to not allow for these indiscretions, whether it's dietary indiscretions that they believe are the triggers. And there's some shame that we have to kind of work through and to allow the patients to have a safe space to discuss. Also, questions about identity now that there's this diagnosis on board, I think certainly come up and is a major theme that we end up talking about. Disclosure. Who do you disclose your illness to? These are all topics that come up. I think especially within the family and extended family and my South Asian patients. I'm actually done a few I'm trying to do a qualitative study looking at patients' experiences with South Asian patients' experiences with IBD and stigma. And that's something that's come up a lot, this idea of, who does my family tell that I have this condition? And even when I have a flare, who am I telling and who am I not telling? That's something that comes up a bit. And then, those, symptoms of depression and anxiety and post-traumatic stress are also primary targets that come up in my office.
Absolutely. I think that is so important, and it really echoes my patient experience, and I'm sure it echoes Ashley's patient experience as well. And Dr. Taft, if I could ask you, why does this matter? Why should I as a patient bring up mental health considerations with my GI and seek GI psych support?
I think, the simple answer is so that you can feel better, so that you can live day to day with less symptoms of anxiety or depression or traumatic stress, even fatigue, some of the physical symptoms of IBD that aren't just in the bowel, but like the other general systemic things that people with IBD often experience, are also linked to conditions like depression. People who are depressed have a lot of fatigue. People who have a lot of anxiety all day, think about how exhausting that is, right? You've got your foot on the gas of the car all day. And so you're going to lose any energy you may have been able to muster. So just to feel better, and then as Dr. Pandit mentioned, when I'm depressed or anxious, I may not feel motivated to follow my treatment regimen, which might be okay for a little while. As I mentioned, I'm a patient. I certainly have gone off treatment over the 20 years that I've lived with this. It always has caught up with me, right? I think I'm being clever. And so to make sure that I can, make, I say, sound decisions about my own well-being, care enough about myself. If I'm depressed, I might not care so much about how I'm doing. Really engage fully in life as much as we can. The physical limitations that IBD can place on us are enough. And so if I can strip away the mental limitations when they pop up, that really leads to much higher quality of life.
I think that is so helpful. Thank you both for putting this in perspective as well. And just to kind of reiterate, I think it is so important for us as patients also not to think of IBD as a collection of symptoms, but rather think about what is its impact on us as individuals, in our families, in our workplaces, in our relationships, and what is it that we can do to ensure that we show up as fully as we can. And addressing some of the mental health challenges that IBD might be bringing up might be one way that helps us to be more present fully where we are needed and be experience that elevated quality of life and feel like we have fuller lives as well, even as we deal with IBD. And very important point about treatment follow-up and treatment compliance. If you feel that your IBD is getting too much to handle and that you are missing appointments, that is a very important red flag to discuss with your providers and seek the support that you need so that you can be on the care that you deserve. And, because we've kind of discussed some of the provider perspectives, I want to turn to you, Ashley, and ask you about your patient experience. What has been your experience like navigating IBD and the mental health and well-being challenges that you may have experienced? What has helped you seek support, and what have been some of the barriers, if any, in accessing mental health services as well?
For sure. Thank you so much for the question. I think almost everyone can emulate the fact that it is definitely a roller coaster trying to navigate mental health and just your overall well-being with IBD. It is a multidisciplinary disease. So, in the event that you have a certain manifestation in your stomach, it is also taking an impact on the multi-organ systems in your body, and that also includes your brain. And so some of my many challenges were largely the acceptance of the disease, because the acceptance of the disease was so prolonged by the diagnosis. And I feel like a lot of people, especially patients, can definitely relate to the fact that it takes so long to get to the diagnosis that you're kind of developing scar tissue in your mind. It's like mental health. It's never going to go away. It's going to be there for the rest of your life. And that challenge, it ultimately bleeds into becoming a long-term challenge that you might have to unlearn certain behaviors, unlearn certain actions. And I would like to say some of the largest challenges I had was being able to validate the emotions and the behaviors that I exhibited towards the people in my community, the clinicians, just kind of asking for help and feeling that sense of desperation and having doors close on me. And, when it came to, for example, getting the diagnosis and seeing my mental health deteriorate, I didn't feel validated. And that became a challenge in itself, because once I got to the diagnosis, I realized, okay, if I come and say, hey, I am experiencing these very real, very valid mental health challenges, will my clinician be able to help me? And so the way that I like to plan out is I am a vocal person, and with the support of the community that I've been able to find online, such as the South Asian IBD Alliance, and seeing the kind of collaborative work we're doing with patients globally, I was actually able to muster enough strength to be able to ask for my own help. I realized that in the gray area of me being diagnosed up until the point where I was being presented the option of having surgical intervention, I realized that I had the choice of, if no one was going to ask me how I was feeling, I'm going to have to ask for myself. Because as a person living with this young adult disease, I have hopes, I have dreams, I have goals, and they have taken a complete standstill. And now I have to navigate all these hopes, aspirations, dreams, with this very big, dark cloud, which is this disease, or that's how we have known to see this disease. And so when I asked for that help, I realized that I have to be able to break that sound system, but I wish clinicians and I wish experts in the system could meet us in the middle. And I'm very grateful to be having that conversation. So yeah, those are just some of the experiences that I've had and how we've been able to overcome it.
Thank you so much for sharing. And I think I relate to a lot of what you're saying as well. I think when I was diagnosed, again, it took me a really long time to get to my diagnosis. So I was just relieved to know what was finally wrong with me and feel like this was not all in my head. This was not all like, something that I was making up or imagining. But like, I think around 6 to 8 months after I was diagnosed, I was, again, like you're saying, it's a disease that hits you when you're young, you have your plans. I was applying for my PhD for the first time around when I was diagnosed. And I was like, you know what, I'm going to withdraw my PhD applications and I'm going to really focus on my health. And I told myself initially that, I'm already on this medication. I'm going to change my lifestyle. I'm going to change my diet. I'm going to really focus on getting myself better. And like 6-7 months later, in the middle of the pandemic, I was just like, okay, so that didn't go according to plan. My disease is progressing. I'm not responding to my medications. I've been hospitalized multiple times now. And I was so lost and scared, and I couldn't understand what I had done wrong. And kind of going back to something Dr. Pandit said as well, there's that very strong feeling, especially something I'm seeing in myself as a South Asian, but also in other South Asian patients that I speak to, that it is something that I have done wrong. It is something that the patient has done. And there is that feeling of helplessness, of not knowing how do you get out of there, right? And I also think for me, what what really hit me was the chronic nature of the disease, that this is a progressive disease that I'm going to have to live with for the rest of my life. And what does that look like for me really hit. And finally, I think the pandemic was not a good place for most of us from a mental health perspective, but I felt really isolated. And I also felt very isolated from my friend circle who didn't know how to show up for me, for many members of my family who didn't really understand what the big deal was, because, after all, this is a bowel condition, right? And I think these kinds of challenges that we navigate from diagnosis through flares, and this is not to say that, when you're in remission, life is beautiful and mental health is all great and you don't have to address it. I think these are challenges that follow you across your disease journey. And I also want to put out there that I really struggle with my own internalized stigma around seeking help, right? Like as a South Asian woman and as that whole eldest daughter, you feel like you have to get it all together. You are the one that's supposed to help the rest of the family. You can't be the one that's sick, and you certainly cannot be the one that's falling apart emotionally. And I've had to really actively work very hard on unpacking this for myself and thinking that, if I take my physical health seriously, then I have to take my mental health seriously as well. Because the common message that I think all of us are putting out there today is that mental health is health, and you have to treat mental health as as a health complication that you have to manage, as something that you can navigate, but as something that needs you to be aware of and intervene appropriately. And the other challenge that I think we've kind of started discussing, and I want us to unpack a little bit more, is the absence of adequate mental health services to meet the needs of all IBD patients. The work that Dr. Taft and Dr. Pandit that you do is so enormously important, but it needs to be more widely prevalent and widely accessible, and to help patients navigate some of the very disease-specific experiences that we have as well. And with that, I want to switch focus so we can really hone in on one such disease-specific experience, which is trauma. How do you negotiate trauma? And there is so much to be said about IBD-related post-traumatic stress, a lot of the research that Dr. Taft and Dr. Pandit, you guys have done. And I really want to kind of unpack this a little bit and understand, what does it mean? How do we navigate this? And what is it that we can understand and help equip our patients better with as well? So, Dr. Taft, I want to ask you, what is post-traumatic stress and what is IBD PTS?
I'm going to keep an eye on the time because I could probably talk for the last half hour on this topic, because this is such a important part of my research and clinical work, I think. Post-traumatic stress disorder is probably something people have heard of. We typically think about it in like combat veterans, people who are victims of a crime, and it can be simply defined as a state of chronic stress after an event where I felt really significant threat to my life or bodily harm. Mm-hmm. And medical PTS or medical PTSD is kind of on a little island. There's some debate in our field of psychology and psychiatry whether it's a real thing, whether medical events can meet that criteria. And I'm sitting here yelling, of course, but there's some debate still going on. So someone with chronic post-traumatic stress symptoms has a cluster of things going on where when it relates to IBD, let's say a person had a really difficult hospitalization. And now after the hospitalization, or even while still in the hospital, having these symptoms of nightmares about what happened, reliving that experience. Then also while awake, I can have a flashback, right? I can it's like I'm just in it. I'm watching a movie of what happened, and I don't want to. That's the last thing I want to think about, is that experience. So avoidance is another set of symptoms that we see. People avoiding anything that might set off those traumatic memories. That can be talking about it. That can be going to doctor's offices. That might be in the same hospital where the trauma happened. Mood changes, so depression symptoms, anger, a lot of anger, irritability can show up as well. Changes in how I think about myself, the world, and other people. So my thoughts can become very extreme, and I say distorted, but not really like distorted, like not helpful. There's my disease is dangerous. It's not a distorted thought, potentially. but thinking about that, ruminating on that becomes unhelpful. And then this state of hypervigilance or feeling keyed up, on edge, on alert. And, that is something that is hard when the threat is your body. So the main difference about IBD, PTSD, or any other medical trauma versus non-medical trauma is the threat is my body. I can't escape my body, right? I can get out of the war. I can move out of the city. I can leave the environment, or the threat may end. In medical trauma, it doesn't. And the chronicity and the ups and downs, the flares and remission, we're just starting to understand how different it looks. But the research just isn't there yet in IBD. We just have some snapshots right now.
Thank you. That's helpful to kind of understand. I think especially this idea that you cannot escape your body. And Dr. Pandit, just to ask you to build up on that, what are some of the risk factors that IBD patients may have when it comes to developing PTS? And what is the impact that this has on patient quality of life?
I think Dr. Taft is probably an even better person to ask about the risk factors. I do, just in my own anecdotal experience in working with patients, typically they're referred after hospitalization, as Dr. Taft mentioned, and it kind of getting to that idea of, you can't escape your body, which is the potential source and continued source of and reminder of the trauma. And yet kind of the idea behind IBD and mental health is, how do I accept and love this body and mind, and dealing with that sort of juxtaposition. It can be incredibly challenging. I think just to give a few more details about some of the experiences that I've either worked with patients about of prolonged hospitalizations. I think with IBD, someone might go into the clinic, not knowing how severe their disease is, and be quite surprised to learn that the indication is a surgery. So that surprise, that surprise, and also feeling as though their medical team haven't had enough conversations with them about what's going to happen, or not giving them many choices, maybe because there aren't any. There's not much time for them to adjust to kind of the significance of having a surgery, let's say. Also just kind of the idea that long hospitalizations can kind of be very disorienting as well. It can be challenging for patients to even have the ability to look back on that experience and find a synthesis in their experience, because it was so long and so much happened, and yet they don't really feel like they know kind of the ins and outs of why things happened the way that they did. I know that the hospitalization piece is certainly a risk factor.
Dr. Taft, did you want to add something as well?
No, I think, Dr. Pandit covered the main, I think, threat of IBD, the disease itself, the diagnostic process, just thinking through those studies we've done. We did some qualitative or interview studies with patients, things that people specifically mentioned that kind of surprised me. But then after the fact, I was like, well, why would that be surprising? Colonoscopy pictures that, you're coming out of sedation. And at least here in the US, I'm not sure if this is done in India regularly, they hand you a piece of paper with all these pictures on it. And it's like, this is what the inside of me looks like, without much explanation, or without explanation where I'm in like a more lucid state. And so that I thought was an interesting and important thing to consider. So some of these things that I think our physician colleagues are like, this is really important, I'm giving information, can kind of backfire. The other things that came up were the way that surgeons discussed what they saw. The language that physicians use is important. Nasogastric tubes are a highly traumatic experience. Just think about what's going on in that whole situation. So there's several, but those were the big ones, and it didn't matter necessarily if I had one hospitalization or 10. I can develop post-traumatic stress after one event. So that's important. But then there's this cumulative complex trauma that starts to happen with people who have very, repeated hospitalizations, repeated surgeries. It's like one on top of the other. And if we don't address the PTSD, it just tends to get even worse over time.
I think that's very helpful to know. And I'm going to pick up on something Ashley said, which is if people are not asking me, it's my turn to ask my providers. So when is it that as patients, what is it that we must look for? And when do we approach our GIs for referrals? Or if we already have a GI psych in place, what is it that we discuss with them? When is it key for us to get our care? Dr. Pandit, if you would like to go.
Sure. I think Dr. Taft mentioned some of the symptoms of PTSD, like nightmares, flashbacks. I think kind of a one that we might be able to start to see more objectively is avoiding healthcare, avoiding the doctor's appointments, avoiding the hospital. Disturbed sleep is another one, which is really, really common and important to bring up. And I think also kind of ups and downs with mood, kind of feeling more irritable than you usually are. I mean, that can come from a variety of different reasons, but can be a symptom of actually depression, anxiety, and PTS. So kind of noticing, lifestyle factors changing, health habits changing, noticing yourself not being less inclined to take medication or go to the hospital, noticing your relationships change, kind of the tenor of your relationships, your willingness to engage with other people. Those are all, really important to look at.
Absolutely. I cannot agree more. And I just also want to emphasize that the one thing that both of you said, which is that this is not about a set of, it's not that your disease is not severe enough for you to develop IBD PTS. It's not that you need 200 hospitalizations or 20 surgeries to have PTS. If you're noticing this, these are symptoms that you have to engage with for yourself as well, recognize the toll that it is taking, and then flag to your medical team as needed, because these are real symptoms. These have a significant impact on quality of life, and it's very important for us to address this upfront and not say that, well, this person has it worse than me, so how is it that I am experiencing trauma but they're not? So I just wanted to put that out there as well. And also kind of moving a little bit into the culture aspect of things. I think we've all brought it up, but we might as well discuss it. What is the role of cultural stigma here in terms of PTS, in terms of navigating some of these challenges that come up with IBD, and how do you discuss this with your patients? Dr. Sumit, if you'd like to discuss this from your experience as well.
So now we can go on talking for another 1 hour because of the culture.
We really can.
Okay, so talking particularly to Indian culture, I'm not very much well versed with the other communities, but any chronic illness, as I mentioned earlier, is stigmatized. Taking long-term medications, and dare I mention in the first visit that the medications are going to be lifelong. The general acceptance of the disease, like Ashley pointed out, acceptability of the disease, acceptability of the fact that medications will be long-term, maybe lifelong in all likelihood, is really, really traumatizing for the patient. And it's actually, the culturally we have been brought up like this, that, you take medicines only when there is no other option. Okay. Most of my patients will go on to look for other options, and those options are not, the standard of care treatments. So we are talking about alternative therapies. We are talking about, pseudotherapies like healing, Reiki, all those paraphernalia, people claiming that, they can heal a patient with spirituality by, talking sense into their head, or just by modifying their diet, they'll be fine. So that cultural stigma actually worsens what a person is going through. There is always that fear that, we have brought it on ourselves. A patient is always fearing that. You mentioned that, being the eldest of daughter, I have responsibilities, I have certain kind of standards to live up to. So that has been ingrained into us when we are, when we are growing up. You are the eldest, you are the responsible one, you have to take care of our families. So that's so much of burden. So you don't want to talk to your parents, you don't want to talk to your friends, you don't want to share that you're not feeling well. On top of it, you're having all those terrible bowel symptoms. So, things just get compounded from there itself. The cultural stigma also comes in seeking help for your mental health. So for some reason, mental health is not considered a health. Mental health is like, you just have to fix it yourself. Why are you even complaining? So I always tell my patients that, if you're running a fever, most of your family members will be very, very sympathetic. They'll be asking you for food, whether you've taken medication, let's go to a doctor, oh, you look terrible. If you're not running fever and dare you complain that, I am not feeling well. Okay. It's like, just buck up, just get your act right. Move out, you'll feel better. It's nothing like, I'm not feeling well. So, mental health is absolutely not considered health. So the first thing I think which we all have to understand is mental health is health. As you only said that, yeah, that's the right way to put it. It has to be treated in the same way you treat any other symptom, you treat any other disease. Talk to the right people, take right help, take right medications, and most other things will be sorted. But again, everything starts with when you start having a conversation. It has to be most of the times initiated, I personally believe, from the provider end, from the physician side. But again, the patients have to be empowered enough to realize that if they're not feeling well on top of it, whatever symptoms they might be having, they have to discuss it. It cannot be just brushed under the carpet and said that, we'll take care of it ourselves. And no, we are not anxious. It does not make you weak if you seek help, if you're not feeling well.
I think that's really helpful, Dr. Sumit, and I think you put it really, really well. And Dr. Anjali and Dr. Tiffany, I also wanted to ask you, where do you see the intersections of culture and IBD, PTS, and what is the role for culturally cognizant healthcare services?
Yeah, I think
yeah, please go ahead.
Yeah, sorry. The small study that we have in folks of South and South Asian descent, that we looked at post-traumatic stress and we looked at stigma at the same time. We had that forethought because I think it was Tina and you, Madhura, who were like, these have to be related. So our sample is small, and I think some of you may be attending today, maybe helped participate. So I say thank you to the SAIA community for helping with our research, which has been critical in getting an idea of what's going on. So the rates of IBD PTS in the South and Southeast Asian community are about 3 times higher than in their white, non-Hispanic American counterparts. So about 47% of people in our study met the criteria for moderate to severe symptoms of post-traumatic stress because of their IBD symptoms. So then when we looked at how does this relate to stigma, I think in PTS, again, the literature that I can talk about is not really medical trauma. So I put a little asterisk on this, but in the broader PTSD research, shame and guilt are big emotions associated with post-traumatic stress disorder. And so if we extrapolate that from what Dr. Bhatia said, it's this sense of, I did something wrong, shameful, I'm defective, there's something, bad here with me, then how am I going to talk to people about a trauma that I experienced? And unfortunately, when those things are together, the treatment for PTSD, if someone were to come to see me or Dr. Pandit, is to talk about the trauma. That's the primary way that we kind of treat trauma. And so if I'm too embarrassed or ashamed to talk about my disease, and how could I talk about this? How could I be traumatized by this? I didn't go to war. I didn't have, this is just illness, so it all just kind of layers like a big messy sandwich on top of each other. So they're critically, in my opinion, related.
And Dr. Pandit, if I could ask you, what is the role of cultural cognizance in this context?
Sure. Yeah, I think every patient is different, right? Every single patient comes from their own personal experience or own histories. And so, one thing that I'm passionate about is this idea of actually providers getting away from cultural competence sort of models and into more of a cultural humility perspective in approaching patient care. it's a concept that's been floating around medicine in different kind of realms, but can we really put the patient in a collaborative driver's seat with providers and really try to ask the questions that providers can really get to know what the concerns of the patient are, instead of making assumptions about what they think are definitely present. And I think the research that folks on this panel are doing, it's going to really, really help clarify what kinds of questions providers should be asking patients, but allowing patients to fill in those gaps and to really describe their experience so that there can be this shared experience, and the path looking forward will look different between any patient that walks through the door. So kind of taking on that kind of approach to working with patients.
For sure.
Yeah.
I cannot agree more. And, kind of to bridge what all three of you have said, I think, cultural experiences are so diverse. It's so important to allow, rather than assume, allow patients to have that conversation as well. And I do also, before turning to Ashley, want to address this thing of, and this is something Dr. Sumit has also addressed, which is, does India really need culturally competent healthcare? We're not, we're not immigrants in this country. We have shared cultural experiences. And I really want to address that by emphasizing what you just shared, Dr. Pandit, as well, which is that India is such a culturally diverse country, and there aren't necessarily cultural similarities, say, between me and Dr. Sumit either, like, with Dr. Sumit being based in the North, me being based in the South, the age differences that we have, the differences we may have in religious beliefs and cultural practices, food habits, what are the, social roles that we play in our specific communities, right? And given that there is such a diverse amount of difference, in countries like India, you also have mental health providers who may not be working with a lot of IBD patients, who may not understand what is the unique cultural barrier that a patient might experience because of the unique disease experience itself. This is a bowel disease. There is that feeling that, why do you need treatment for a bowel disease? Why do you need such expensive treatment? Can you get married with IBD? Can you bear children with IBD? This kind of stigma that ostomates have, for instance, you cannot enter a kitchen, you cannot go to a place of worship. These are concerns that may not become immediately apparent to mental health providers who may not be engaged with a lot of IBD patients. And I really think what it comes down to is what you said, which is, let's have conversations, let's find that common vocabulary to understand what is it that patients are experiencing and how is it that we can work from there. And like Dr. Sumit said, yes, providers asking the questions help. But again, we'll go back to what Ashley said, which is, if providers are not asking, it is also our place as patients and our right as patients to bring up some of these concerns and feel like we have the right to be heard, because these are real experiences. And I think the underlying factor really is empathy. And Ashley, I wanted to ask you, what has been your experience of navigating IBD-related trauma, if you have any, and kind of switching to that gear of what has helped you cope? What have been some of the strategies that you've put in place?
For sure. Thank you so much for that question. It's definitely a hard-hitting one. I feel like everyone can relate to, especially with this disease. I'm just going to list off some of the many traumas that I've experienced over the last couple of years, either pre or even during or just living with this disease. One largely is that societal pressure, especially if we're looking at it on a cultural competent level. It's a young adult disease. You have goals, you have dreams, you have aspirations, but there's also societal goals, dreams, and aspirations you're expected to fulfill. Being a South Asian woman of color, you have to understand that people want you to have a family. They want you to get married on time, which I don't necessarily understand what on time means, because our life has kind of been put at a standstill. On time is not happening for us. This is our time. Diet hypervigilance. I feel like, especially in the South Asian community, or just generally, food is a love language, but food is also a very big facet of your behavior. And, when you have gone through a flare or experienced major surgery or just major complications with this disease, you're struggling with knowing what you want to eat, what you can eat, what's good for you to eat. But not only that, you have the societal pressures of people questioning why you're eating what you're eating, the choices that you're making, and just trauma related to even body dysmorphia. Many patients with IBD go through major surgical interventions, or they lose tons of weight. I know in 2021, I was 95 pounds. I am now at the weight that I was before I was starting off with my very first flare. And that's been such a huge trajectory, but I can't help but avoid people saying you look good now. I don't know what you look good necessarily means. I feel healthy. I'm proud of where I am, and I'm proud of the fact that nutrients are being absorbed in my body. And I think that that's about high time for people to not talk about body dysmorphia, because it can project as trauma, and trauma is lifelong in that facet. Other things is, having the option of having surgery again. With this disease, it's just because you've had one surgery, that doesn't mean you're not going to have surgeries again. You're going to have surgeries. There's unpredictability of this disease. And I think one big thing in the South Asian community is even taking the decision of choosing to have surgical intervention. I know that for myself, it was an elective surgery and I chose to have it. And I got a lot of questions, why did you choose to do? But I was in a position where I knew that based on the conversation I had with my surgeon, that was the only way that I could go to live the life that I wanted to live, to achieve the goals and dreams, and, even achieve the goals and dreams of the society that's pressuring me to achieve those goals and dreams. And I think trigger words, I think like the words like you look fine. Sure, I look fine today, but, in a society where you have AI, social media, and apps like Facetune, you can make yourself look good. I know that right now, we all may look good because it's just a picture. A picture is 1,000 words, but you don't actually see those thousands of words. And this disease is very much invisible. And that is something that in the South Asian community, because of its invisibility, you are just expected to keep moving forward. I know even after my surgery, just a little bit about myself, I was in med school. I did complete a semester and then I chose to drop out. And when I had my surgery and I was doing better, people are like, why haven't you gone back? And it was the decision that I made for myself, because I realized that the system also doesn't support equitable, resources for a student who wants to be in medicine with this disease. So I want to be a part of the system that fixes it, but how do I explain it to someone who doesn't even understand? I think that those are some traumas that you live with lifelong, but some of the many ways that I've been able to unlearn those traumas is know that is my life. My life is my own. I mean, kind of how Dr. Pandit mentioned, everyone's experiences, everyone's challenges and traumas, while they're universally the same, they're individualized. We all have a different journey. While the end goal may be to live a happy, healthy life, I still want to be able to take life in my hands. And so the strategy that I really use is like some words like accountability and ownership for myself. And I know that can be very challenging for people to have those words when you have a lot of people discouraging you and have a lot of people saying that, you should live your life a certain way, but you know you best. And that is the only way that I've been able to move forward in life, is knowing that if someone is telling me that they see myself in a different light and I need to do something, no, but I know internally how I'm feeling. The feelings that I'm feeling, the behaviors that I'm exhibiting, the circumstances that I'm in, that is a decision that I need to make for myself. And even, for example, if you're talking to your clinician and your clinician, says something that doesn't align with the direction that you'd like to go in, you are allowed to stand up for yourself. You're allowed to have uncomfortable conversations with your clinicians too, and let them know that, hey, like the way that you're providing me this care, we may not necessarily be in alignment with the way that I would like to have these outcomes and the outcomes that you think that I'm looking for. And so also some other strategies is really just, addressing, like, I love journaling. I think that journaling for me, maybe that's not something that everyone is, comfortable with, but I really like writing out my thoughts and my feelings, because they're so scrambled with this disease that when I finally have to put those words into a mature conversation, they're articulated in a way where I know that I'm respectfully telling someone that I'm not aligned with the way that my care is being taken care of.
Absolutely. I think that's enormously helpful. Thank you so much for sharing and being so vulnerable with your experiences as well, Ashley. And I think you brought up something that we've gotten questions from the audience about as well, is what do you do when your family doesn't get it? How can you explain the challenges that you may be experiencing with mental health to your friends and family? And how can friends and family support you a little bit better? And I just want to ask you, Ashley, if you want to address that, and perhaps Dr. Sumit, if you wanted to address that as well. Ashley, do you want to go first?
Sure. Like I said, I feel like anyone who's asking that question, just know that you're not alone, because I am in the same boat. I'm 28. I'm at the age where either I should be thinking of getting married or I should be married with a child. But when I was diagnosed with this disease, I was told that even, we already know this, even if you're not clinically versed, is that the minute you've been diagnosed with this disease, even when you're at the preconception phase, you are considered a high-risk pregnancy. There's a lot that goes into even carrying a baby. And the acceptance of whether or not you want to choose to go through it, because we need to understand, I think there's also stigma in understanding that pregnancy in itself is a very dangerous journey. And having the disease interaction with it is also very, it can be dangerous, but if it's a choice, the choice that can happen for you with the help of your clinicians and the support of your team. I think for me, the largest strategy, the largest, I guess, advice that I can give for someone that's trying to advocate for themselves with their family is to know that at the end of the day, you love your family and they have the same hopes and dreams for you. It's just going to take everyone a different amount of time. I think time is of the essence, when it comes to your journey. Like I know for me personally, everyone wants to see me live a happy, healthy life, one day get married, have a career that is fulfilling to me and can keep me healthy and keep me going long term. But that's going to happen on my own time, because I know that I have lost many years of my life trying to navigate this disease, and I have to make up for that time by taking that ownership. And sometimes if that means saying that to the person, or saying that to a parent, to member in society, that this is not your life, this is my life, because I'm not going to come in the way of giving you advice for yours. I can empathize and be compassionate towards your challenges, but I don't know what it is to be in your shoes. So how would you know what it is to be in mine?
For sure. Absolutely. Tackling it head on is a great strategy. Dr. Sumit, any strategies for friends and family who may want to support patients? How can they do that?
No, first point first, Ashley, you were brilliant. I think that journal, all of us, you should put it on public domain and all of us should read that. This was brilliant. So I think I completely agree with her. First is to realize that, depression, anxiety, uncertainties, it can vary from a person to person. Everybody will have their own individual experiences, but it can be there. The patient has to identify that. They have to identify their support group. It can be family. If family is not understanding, it can be a sibling, it can be a friend. They should be talking to their doctors. It is not something which is unnatural. Okay, it's very, very natural to have all these feelings. And if you're not feeling well, please talk. They have to talk to somebody and then ask for help. And if you're feeling that you're not able to cope up by yourself, tell your physician, tell your doctor, have those uncomfortable conversations, as Ashley rightly said. Not every conversation can just start with symptoms, signs, medications, and, thank you, ma'am, and I'll see you at next visit. No, I think we need to do a little more there, especially with a disease which is going to be lifelong. So, yes, I would like to reiterate whatever she said, and I completely agree. So you have to find your own support system, but first identify that, you're going through a crisis. If you cannot take that accountability, then it's a problem.
For sure. I agree. And I would also redirect anybody who's interested to some of the resources on the SAIA website, especially on supporting loved ones with IBD. Also join the Facebook support group if you're not already on there for peer support through this journey as well. And I know we're like up on the hour and I want to start kind of getting to a close as well. And the way I want to do that is to ask each of you, if you had to share one thing to the people who are tuning in, if there's one piece of advice that you'd want them to take away, what would that be about navigating mental health with IBD? Dr. Taft, would you like to go first?
Yeah, I'm going to put my patient hat on for this one.
Yes.
Kind of piggybacking on what Ashley and Dr. Bhatia said, even if you find one person, people are going to disappoint you. People who should be there for you, it can be very difficult for them to be there for you because it's hard for them to witness what's happening to you. Find that one person. I have my person, she's got Crohn's. We talk about stuff that I don't talk about with my husband. And it is so huge for me and has been really important in my own mental health journey with IBD.
Love that. Dr. Pandit?
Yeah, I think just kind of taking a step back into this whole conversation we're having is about how much stigma and taboo there is currently with IBD and mental health. And just the fact that we're having this conversation to talk about it is a path forward to get people more aware of all of this and start to have these conversations more and more. So kind of just, it's calling it out for what it is. It's really hard.
Absolutely, I cannot agree more. And that would be my piece of advice as well. Don't let society hold you back from what you can and cannot share, what is worth,
Yeah.
what is your truth, and owning your truth should be something you do for yourself. Ashley, would you like to, what would be your piece of advice?
For sure. One piece of advice I would really like to give to people in the community is you truly aren't alone. I know that when I was diagnosed and just kind of I would love to bridge off what Dr. Taft said, if you can find that one person, and sometimes that one person doesn't necessarily need to be someone that's close to you. It could just be someone with the power of social media, the power of a phone. My personal experience with it, I was able to, I found Tina. I found Tina just from a blog post, and me may not have spoken, but it was just knowing that there was someone that looked like me, that even though our experiences were different in terms of the clinical manifestations, those experiences were holistically the same. Those feelings were the same. And if you can find that one person, you'd be surprised at the spider web of a community that you could come up with. And last but not least, again, you don't have to be vocal the way that I am, but you're allowed to be vocal in private. Like, find that one person, DM them, send them that comment, repost that story. You don't have to use your words, but express yourself, because it can be cathartic. It can be very healing to know that, you're able to share who you are, because it is a part of you at the end of the day. It may not be your identity, but it's going to be there. But just know that you're not alone. Truly.
Absolutely. Cannot agree more. And I think Tina's played a key role in many of our mental health journeys, mine included as well. So thanks for that, Tina. And Dr. Bhatia, ending with you, what is your one piece of advice?
I have for two sets of different people. So first, my advice is to physicians, to GI, my colleagues. Ask your patient how they are feeling. Be a little empathetic. I cannot give empathy to any physician, but yes, try to be empathetic. Mental health is health, and refer for help if you feel that you see any red flags. To patients, again, to reiterate, you did not bring it upon yourself. So stop going on these guilt trips. Depression, anxiety, uncertainties can be there. It's a part of life. It is a part of this illness. Talk to your doctor, find your support system, and ask for help when you feel you're not feeling well. I think those things are very, very important. I have learned a lot in today's discussion. I have noted some points. I'm going to use them. Thank you for making me a part of this. Thank you.
Oh, thank you so much, Dr. Sumit. And, I'm going to take off from what you just said by thanking all of our panelists today for sharing. Thank you so much for being so generous with your expertise, both as clinicians and as patients. I think it really means a lot to me as a patient, and I'm sure it is enormously enriching for our community as well. And thank you to everyone who's tuned in. Special thanks to our wonderful team on the back end who have been, crucial in bringing this event to life. It's very hard to do this kind of programming without an entire team on the back end. So thank you all. And before I sign off, what's next for SAIA, you ask? We have a fabulous networking event that's upcoming at ACG 2024 in Philadelphia in October. It's going to have a huge South Asian twist. So we're going to have a panel discussion. We have great speakers, and we have a networking event with cultural festivities. So we invite one and all to join us. If you're in Philly, please do come by. Do watch this space for more. The registration will go live in a few days, and we really, really hope you would join us. And with that, I want to say thank you once again to everyone, and I hope you have a good rest of your day.